Thank you so much, and good afternoon, everyone. As all of you know, the prevalence of myopia is increasing, and so also the tsunami of myopia is coming. We have to be ready for the future. So, being future ready does mean we should know all of our weapons as well, isn't it? When Palicaris, he introduced first refractive procedure, that was LASIK. And here we are. With the process of evolution, we have n number of options now with us. We need to know all the pluses and minuses, strengths and weaknesses of our heroes. And that's how we can utilize all of our heroes in our battle. And the chances of winning improves when we know who is the villain and who are our heroes. First and the foremost, captain of our team, LASIK. Yes, still this procedure holds the one of the best option till date and most widely performed refractive surgery till date. In this, a high oscillating blade, the microkeratome blade, creates a flap, and after lifting the flap, the excimer laser takes care of the refractive error, and the flap is placed back. And you can see the different assemblies, different parts of the assembly, and based on the different specifications, it can be pendular movement or linear movement, and these are specifications with different devices available throughout. So, what are the pluses? Early visual recovery, very minimal tissue reaction, very minimal discomfort if we compare it with PRK. No additional inflammation, no haze formation, and retreatments are really, really easy. But it comes with the weakening of biomechanical strength because of obvious reason, flap making. And microkeratome related complications are something which is unique for this, including incomplete flap, free cap, especially for flatter corneas, and buttonhole in case of steeper corneas, which has worse outcome amongst two. And we need to know, we should be aware of subtle, finer refinements required when it comes to very steep cornea and very flat cornea. And advent of femto-LASIK, it's a boon to overcome the microkeratome-related complications. It's bladeless, and it minimizes flap-related complications, especially microkeratome. The flap configuration is planar as against LASIK, the microkeratome. You can customize hinge location, flap thicknesses, and it's very soft when it comes to docking. Opaque bubble layer is one unique complication with this procedure, which vanishes if you wait for a couple of minutes. Rest of the complications like rainbow glare and transient light sensitivity with increased chances of DLK have really gone down, just because now we are with second and third generation of machine, and the amount of energy used is really less. But irrespective of that, still this is a flap based procedure, so flap dislodgement chances are there. To overcome this, there is one more hero, so we have every reason to smile now. This is absolutely flapless, and a small incision is created after femto-assisted lenticule dissection. You dissect it out and you remove this lenticule through a very small incision. So this is truly flapless. So good for sports, people, contact sports especially, and some of the special professions where there is requirement for flapless procedure. It transects less amount of nerves. That's why induced dryness is also less. Visual, I would say, not rehabilitation exactly, but one can start working and resume the normal working very quickly and early with this procedure. It retains biomechanical strength in a better way as compared to any flap-based procedure. And again, very soft docking and low suction IOP. But it comes with a burden of steep learning curve. There can be retained lenticules, lenticular part. It can create stromal scarring, especially with the beginners. Eye tracking, hyperopic and astigmatic treatment was an issue to begin with, but with newer Smile Pro, you have all these options included. Now, there are a couple of more platforms, especially when it comes to lenticule-based platforms. Silk is also there nowadays available. It's faster device, and the ease of dissection is better. Amount of energy being utilized is on lower side. And in market, with every new addition of lenticule platforms, now the new nomenclature is CLEX, that is keratorefractive lenticule extraction for all these procedures. So for the sake of any publication here onwards, SMILE, silk, clear or smart site, these terminologies won't be accepted. You need to know one unsaid hero, that is surface ablation. These procedures are really picking up and the trend is towards non-flap based procedures. You can remove epithelium with the help of alcohol, with the help of mechanical HSK blade, a moist brush, or with the help of PTK mode. And this is very technically easy to perform, especially when it comes to non-cornea people. They are also venturing into flapless in true sense, and good option for thinner corneas where you need to retain good mechanical strength, and good for very narrow fissures where docking can be an issue. But it comes with a baggage of very high post-op pain, longer visual recovery, and haze formation. You need to know the grading of haze, and mitomycin comes as a savior when it comes to haze. Meta-analysis study and all the studies show it prevents haze formation. It's not moving further. Sorry for the technical glitch. Phakic IOLs. Phakic IOLs is a very good option for LASIK rejects and high myopes. It maintains contrast sensitivity, and it's also a good option for thinner corneas and faster visual recovery. Of course, you do have unique complications of cataract and raised IOP. If the vault is too low or too high, you need to understand the optimum vault. And when one hero cannot take care of villain or cannot defeat villain, then second hero has to come into picture. Bioptics is something like this. I'll just wind up in a minute. If you combine two procedures together, that is ICL and surface or ICL and LASIK, you can take care of higher refractive errors. Refractive lens exchange is also one of the options to take care of these high refractive errors, especially LASIK and ICL rejects, but you have to be aware of increased chances of retinal detachments. This is just a table which speaks for the same, and there are a couple of newer options which one needs to know, or good idea to know, especially enhancement procedures for hyperopes, which is picking up very fast. And these are special situations where you should choose one hero over the other, and it would be good idea to know this. Thank you so much. So now we have so many hands and we have a battle. Just choose wisely. Thank you.